Hi, Dr. Joe here to talk a little bit about in the news the swine flu. As many of you have known, we were very concerned about bird flu some years ago and did obtain a sort of stash in the refrigerator, maybe in the freezer, of medications to try to ward off death and dismemberment from the bird flu. Well, swine flu is interesting because it's very close in the relationship of how these things are classified to determine that maybe or maybe not this might be something that would hurt us, much like the bird flu or ordinary influenza. Well, we don't know yet, and the information from back in the 70s about a swine flu epidemic is still in gray area and not sure exactly what happened. If anything was due to the swine flu in terms of death or anything that we were fearful about. A vaccine was created, not used to much extent, and it went nowhere. There is apparently one death now in Mexico from this, so we are a little bit concerned, but that's all. If any of you do have the situation where you have retained the Tamiflu, it has been known to be very effective and provoking good antibodies in response if you do get swine flu. So many of you are already prepared. The other thing we talked about way back when the bird flu was increasing the amount of vitamin D, and at that point we were using the German recommendations that would help people be able to get into a safe place by taking 50,000 units of vitamin D for 5 days if bird flu was in town, whatever that means. It means that actually the nation was having some cases and you must prepare for warding off the bird flu. Well, that's about where we are now, and many of you are taking vitamin D, and if those who are listening have not, the spray D goes in much faster. Within a week or so you're up to the levels which most people think are adequate to do all we can with reference to get your antibody mechanisms in place to prevent swine flu. We don't know anything for sure, but those are standing recommendations that I use all the time. So that's something to think about for yourself. We have both the spray and the capsules here, and anybody can avail themselves of them if they feel they need so.